Welcome, 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 and thank you for spending some of your time with us. My name is Tina Rosenquist, and this is Knowledge for Wellness. And this show is to enhance your overall understanding of information provided to you, because when you know more, you are empowered to make better decisions, to enhance yourself and your loved ones for a better quality of life. And today we are delighted to meet up with Dr. Angela Dreyer, and she is going to give us some information on pediatric care. So welcome, Dr. Angela.
Thank you. Thank you for inviting me here. I'm very excited to be here.
Yes, and we are so enlightened that you got to come and out of your busy schedule. Being a chiropractor in Maplewood, I'm sure keeps you very, very busy.
It does, but I love what I do, so it's all worth it.
Yeah. And what a great avenue to be able to actually wake up every morning and look forward to your day.
I do. Every day I look forward to what I get to do and the results I get to see and the families I get to meet, and I love it.
Yeah. Well, getting to meet people, I don't know that our viewers got to catch the other show that you were on about chiropractic care and health and wellness. And so I'd really like you to tell my viewers about yourself, your passion, your love, why this profession, and add a little bit of tidge to the pediatric too.
Okay,
so,
sure, absolutely.
Yeah.
I first got into chiropractic while I was studying during my undergraduate degree. I was pre-med, going into kind of a biology degree and trying to figure out what I wanted to do when I met a chiropractor that came to speak and inform the students about what chiropractic is. And from then I knew it was the perfect fit for what I wanted to do. So I came here to Bloomington to finish my chiropractic degree, and I graduated with a Doctor of Chiropractic.
Okay.
And then after that, I received additional training through the International Chiropractic and Pediatric Association in pediatric, their certification program. So I'll finish that up this year. I'm waiting for the research program to open up so I can complete that, and then I'll probably be moving on to my diplomate in pediatrics.
Wow.
So I've done a lot of study, and I've really fallen into, and I love the realm of pediatric chiropractic and being able to work with the little ones from all different ages and sizes and seeing the tremendous results they get.
Wow.
I guess the reason I love what I do is the stories I get to hear and how I can have such an effect on people's lives through chiropractic. And when they get healthier together, I see kids' ear infections get better and colic and asthma. And I had a little girl who maybe could go, she went to a overnight stay with a friend, a birthday party for the first time because she was not bedwetting anymore.
Oh, wow.
And she was just delighted. And so to see the look on their faces, it's so rewarding to know that I can help them do that and have a healthier lifestyle.
Yeah.
So kids have so much potential, and it's just incredible.
Yeah, and I love how they always want to please us.
Oh, they do.
Yeah.
And they're so much fun, and they laugh, and they make the atmosphere of the office so much more fun.
Yeah, and their innocence is just so genuine. You cannot even.
They are. They are. It's amazing.
Yeah, it's just great. But that's a whole nother realm. I mean, you don't think of a chiropractor working on children. And, you know, we have gained so much knowledge, even the whole bedwetting issue of what they used to do. So I'd really like you to kind of focus in a little bit more on pediatric care.
I have parents bringing their kids into the office for many, many different reasons. Some are they've heard great things and they just want to bring them in for their health checkups, make sure that their bodies are functioning well and at their best so they get to grow and develop and heal at their best. Others maybe have heard about chiropractic and ear infections, and maybe colic and bedwetting tend to be kind of the most common things.
Okay.
And while we don't treat those symptoms, what we do is we treat the bodies. We treat each individual, and when we locate any misalignments in the spine and we free up any interference and get those joints moving properly, their body is able to function better. And when they function better, they get these windows of opportunity to heal and repair, and then their body can heal themselves from the inside out like it's meant to do.
Yes.
And so then those symptoms oftentimes have been shown to go away, and ear infections can start to heal, and bedwetting can heal, and so the results you can get are just amazing. And a lot of parents I see are kind of looking for some alternatives to maybe what they've been doing, or they just want to know, what is this chiropractic thing, and is it safe, and is this something that maybe could help? And I do my best to explain all that and then see if it is something that would fit.
Sure. And they can gain knowledge from you.
Absolutely.
And then make a decision whether or not. I know a lot of goals that a lot of chiropractors have is to be at the hospital even during the birthing.
Yes.
And that would be a milestone.
That would be.
But the goal here is the patient, is that person.
Absolutely.
And I know we're not quite there yet, but we're hoping to maybe be there sometime. So I don't know what the youngest child is that you've seen, or even some difficulties during the birth, and that mother may have brought that child to you at a very young age, even within a week or two. So if you could embellish about how old are the kids that you adjust, and also the safety, because we always want to put safety as a priority too.
Absolutely. I've seen many kids of many ages. I was able to adjust my niece and nephew when they were just a few hours old. So parents will bring their kids on the way home from the hospital, even before they get home, to make sure that they get the best chance at an optimally functioning nerve system. So a few hours to a few days to a few weeks, a few months, a few years, anywhere from toddlers to then teenagers, adolescents. So there's a really great range, and kids are never too young and never too old to benefit from chiropractic care. And I tailor the adjustment depending on the age and what that child's presenting with. So the adjustments are very, very safe. They're very gentle and very effective. We don't, and I don't adjust kids like we do adults.
Right.
So there aren't noises and the popping noises that sometimes you get with the adult adjustments. It's very, very light touch and very gentle pressure, oftentimes just with my pinky finger.
Okay.
And if we had a ripe tomato sitting here, it would be the same amount of pressure we could apply to that tomato without indenting the surface. So it's very gentle, very specific. Most of the time the infants don't even wake up, or they'll giggle and they'll laugh, and they really enjoy it. Every once in a while someone will cry, but that's okay. And it's just very safe and very effective.
Yeah.
So, yeah.
And just to think of the outcome, and then you're going to prevent them from food allergies, ear infections.
Oh, yes.
And I bet their immune system is increased too, because the body is actually doing what it's meant to do to full capacity.
We have a huge impact on the immune system, because as we fine-tune the nerve system, your brain, the spinal cord, the nerves that come out from there are controlling and coordinating every function of that body, from the immune system to the digestion and elimination to the muscle control and how they feel and hot and cold. The nerve system's at the hub of everything.
Yes.
So when we just free up any interference in the spine, allowing that nerve system to function better, now the immune system's stronger. They're more resilient, and we see kids that don't get as many colds and flus and no more runny noses. I have had a family who, for the last 3 years, hasn't had any meds, any antibiotics, hasn't been sick, no colds, no flus, because their immune systems work really, really well.
Yes.
And every once in a while maybe they'll get a cough, but then they're over it, whereas everybody else maybe has that cold for 2 weeks.
Sure.
So when their immune systems are that much stronger, it saves time and money and sleepless nights on both kids and parents.
Yeah.
So it has such a huge impact, and kids really respond really quickly and faster than adults do, and it's rewarding to see that change so quickly and that benefit so quickly.
Yeah. And this is such an up and coming now, because when I was raised, you didn't see a chiropractor. That was the kind of taboo.
Yeah.
And so now it just seems that people are educating themselves more, enhancing themselves with all of the different variables that we have now in medicine.
Absolutely.
Yeah.
People are finding out. I get phone calls and I run into people that say, what is that chiropractic thing and how does it work with ear infections? And I know someone who brought them in and they were colicky and then they slept through the night. People are hearing stuff, and it's great that they're maybe looking into different alternatives and just want to know more about how we could maybe help.
Well, if you have, 3 months of sleep at night because you have a colicky baby, what do you have to lose?
Exactly. And just 5 extra minutes of sleep can make a world of difference.
Yes.
So, absolutely.
That's great.